Hello everyone, I'm Gayle Aycock, President and CEO of LRADAC. I hope everyone has been doing well since we last spoke. Since we last spoke, there have been many challenges, that is for sure. And I want to just thank our patients for their patience. I'd like to thank our supporters and our friends that have helped LRADAC during these challenging times make the best decisions we can for our patients and for our staff. I would like to thank especially our LRADAC family, our own LRADAC family, our staff, because they have given their all to make sure that as many patients as possible can continue to receive services. Although our buildings have been mostly closed, we have maintained contact as a staff, and we have been able to reach many of our patients virtually through telehealth and telephonic contact. We also continue to operate our withdrawal management detox services. We've also recently been able to go forward with some prevention efforts using our telehealth equipment. We are now working towards reopening on-site services at the LRADAC sites. Our number one objective in our preparations to create this possibility has been to ensure that our patients and our staff come back to work in as safe of an environment as possible. Our teams have been working very, very hard to prep our facilities and to put in processes and procedures that will ensure that we social distance, that we ensure that before people enter our buildings, patients or employees, that we screen them for and do temperature checks to ensure that someone that maybe is beginning to be unwell does not enter services or come to work. We will continue our conscientious work of using professional sanitizing services to create as clean and healthy environment as we can. We will also require wearing of masks for both patients and staff. I believe that wearing masks are our best option for keeping each other safe. I also think it's a way of showing respect to each other. I wear my mask to protect you. You wear your mask to protect me. It is up to all of us and each of us to do our part to keep the infection rates of this coronavirus going down and not surging up. We began our first phase of resuming on-site operations in early May. During that time, we began prepping buildings, securing personal protection equipment for all patients and staff. In the last couple of weeks, we have been able to offer virtual prevention programs and also on-site intervention ADSAP services along with urine drug screens on site. Beginning around June 8th, Phase 2 begins, and continuing to utilize social distancing guidelines, we will bring on site our adult intensive outpatient services for men, our young adults, for women, and for co-occurring patients. For now, our recovering professional program will continue to monitor their patients via telehealth. Soon, we will restart scheduling on-site assessments. There will be no walk-in assessments. All assessments for the time being must be scheduled. In July, Phase 3 will begin, and we will resume on-site adolescent intensive outpatient services. Throughout all the phases, we continue to utilize virtual meetings when possible to keep staff and patients' presence on site at a minimum. We will also be establishing CDC recommended safety protocols in the event that a patient or a staff member becomes ill with the coronavirus. These procedures will include quarantine, sanitized cleaning, notifications to any affected workers or patients, and emergency response if necessary. During LRADAC's plan of phased-in operations, we will be monitoring any and all COVID-related case numbers and health updates from CDC and DHEC. In the event that cases of the coronavirus surge up, then we will assess our operations and act in the best interest of our patients and our staff. It is our hope and intent to return to full capacity operations while also embracing safer and more effective ways to operate in the future. We will be stronger in what we do, and we will work smarter. We thank you for your support, and we also invite you to please stay tuned to our Facebook page for some tips on preventing relapse, ways to avoid alcohol and other drug use as a coping mechanism, and we will also be providing some suggestions on maintaining your best mental and physical health. From everyone at LRADAC, please stay safe, please stay healthy, and know that we remain your community resource and partner through these very challenging times. Please stay tuned to us. We look forward, I hope, to seeing you soon. Stay safe. Thank you for listening. Bye-bye.